skeletal system and muscular system are most closely related to mobility function. As age-related change. As people age, calcium absorption, estrogen in women, and testosterone in men are decreased. Bone resorption, parathyroid hormone are increased. Functional mammal cell is reduced. Regulation of osteoblastic activity is impaired. This change is responsible for osteoporosis. As people age, muscle strength and endurance also decrease. Also, there will be a degenerative change of joint and connective tissue. First, diminished viscosity of synovial fluid and degeneration of collagen and elastin cells. Number 4, nervous system. As people age, there will be change in their visibility, impaired proprioception, decreased body balance, which also include a slower response of the central nervous system. Number 5, osteoporosis now is considered as age-related changes. Osteoporosis is a disease in which bone resorption outpaces bone deposit. The bone becomes very fragile and easy to break. That's why a lot of people have bone problems as age. Osteoporosis occurs more in postmenopausal women and aging. The factor contributes osteoporosis are estrogen decrease in menopause women, diet poor in calcium and protein, smoking, and diabetes mellitus.
Risk factors in activity and mobility in the elderly are categorized into 3 major risk factors: biological and medical risk factors, behavioral risk factors, and environmental risk factors. In biological and medical risk factors, there are muscle weakness and reduced physical fitness. It is a contributor to having difficulty of accomplishing daily activities. Vision changes are another contributor to falls because it can reduce someone's depth perception. Physical disability can increase the risk of falls because when people age, everything in their body slows down which affects the 5 senses of the body. Cognitive impairment. People with cognitive disorders such as dementia or Alzheimer's disease are at risk of falls because they are often confused, which can affect physical judgment. Behavioral risk factors. History of previous falls. Having a history of previous falls is a risk factor as well as an asset to how often a person falls. This information is helpful because it can help reduce the likelihood of another fall or slips in the future. Footwear and clothing. Having the proper footwear or clothing can help minimize falls in the elderly population. If a person does not have proper footwear, then it may cause wear and tear to the soles on their feet, which will cause them to trip and fall on their backs or hips. Fear of falling. Believe it or not, fear of falling is a risk factor but it can also be a very motivational tool. People with the fear of falling don't necessarily fear the physical action of falling itself, but more so the thought of losing one's independence, falling again, and hospitalization. It can also be used as a motivational tool because it gently forces the elderly to take more precautions in their daily activities in life in order to prevent falls. Environmental risk factors. Environmental risk factors include stairs, which is a risk factor towards an elderly because of the different types of surfaces a stair can have, whether it be slippery, narrow, high, or even the ones that have slits in between its steps, which is very hazardous because the legs and feet may just fall through and can cause a serious fall and even death. Hazards in the long-term care setting. There are also hazards in the long-term care settings due to the fact that it is always busy. There are times that the staff will forget to lower beds after giving care, which makes it a potential hazard to the residents because they may fall off their beds. Assistive devices. The sole purpose of these devices, such as canes and walkers, are to help promote independence and mobility towards the elderly. A minor setback would be that cane tips may experience wear and tear, which can be potentially hazardous, and walkers with different settings may be switched from resident to resident, which is very bad.
Okay, the role of the nurse in relation to health promotion and disease prevention for activity and mobility include environmental management, exercise promotion, fall prevention, health education, risk identification, and teaching. When assessing an older adult for musculoskeletal function and risks for falls, fractures, and osteoporosis, the nurse should pay particular attention to factors that can be modified or reduced through nursing interventions. A fall risk assessment tool can be used to identify older adults who might benefit from preventative measures. The assessment of overall musculoskeletal performance begins with observing the person's mobility and activities. The nursing assessment should include usual mobility pattern, risks for unsafe mobility, risks for osteoporosis, health behaviors, and safety of environment. Once limitations are identified, the nurse should find out if the person is using any assistive devices to improve mobility, balance, or overall function such as safety and independence. If the person is not using any devices and may benefit from them, the nurse should inquire about the person's knowledge about the availability of such devices and how the person feels about using them. A nurse has an important role in preventing falls through addressing medication-related risks by minimizing medications, initiating an individual tailored exercise program, have visual function evaluated as part of an overall fall prevention program, address postural hypotension and cardiovascular problems, provide vitamin D supplements in combination with calcium supplements, address foot problems and ensure that the person wears proper non-skid footwear, provide and implement individualized fall prevention care plans, and facilitate referrals to rehabilitation therapists. Other preventative measures include modifying the home environment to eliminate home fall hazards such as clutter, poor lighting, and lack of grab bars. If a person does experience a fall, a post-fall assessment should be done immediately and at appropriate intervals after the fall. It is important for nurses to teach healthy older adults the benefits of maintaining an active lifestyle by performing various exercises to promote healthy musculoskeletal functions such as increased bone strength, increased total body calcium, improved coordination, and improved overall body functioning. Flexibility exercises should be encouraged to promote range of motion, and moderate aerobic exercise encouraged to prevent loss of muscle mass. The nurse should also promote holistic type of exercises that address balance, mobility, and the body-mind connection such as Tai Chi, and promote yoga for building up BMD after menopause. Weight-bearing exercises are an important intervention for osteoporosis, as well as maintaining a healthy weight, having a total daily intake of 1,200 to 1,500 milligrams of calcium and 800 to 1,000 international units of vitamin D in food or supplements. Having their BMD measured at 5-year intervals beginning at the age of 60 years for women with risk factors, 65 for women without, and at the age of 70 for men. If applicable, quit smoking and limit their alcohol intake to no more than 3 drinks daily. Clients who have osteoporosis should talk with primary care providers about medications for osteoporosis, biphosphonates, calcitonin, estrogen, and selective estrogen receptor modulators, parathyroid hormone. Finally, it is important for the client to know that calcium may contribute to constipation. Therefore, measures should be taken to promote bowel function such as regular exercise and adequate fiber and fluid intake. Calcium supplements can also interact with some medications such as decreasing the absorption of tetracycline. Foods that are high in calcium include milk, cheese, yogurt, custard, ice cream, raisins, tofu, canned salmon or sardines, and broccoli and other dark green vegetables. Calcium carbonate, which is found in some antacids, is an effective and inexpensive source of elemental calcium, and it should be taken with food.
Community resources to help seniors remain active in the community. Some of them are Berry Parks and Recreation. They offer programs at through their 55 Plus program, and there's 2 locations. One's at Allendale Centre and one's at Parkview Centre, and they offer drop-in sessions at a minimal cost for the seniors, about $53.81 a year for residents of Barrie, and just over $100 for non-residents. Each program offers the outreach program offers support to older adults within the Barrie community who, for a variety of reasons, are unable to take advantage of the 55 Plus program centers. And this is a day program where someone will come in and help them with exercises and things like that. Barrie Recreation also offers a travel club, and this program offers a variety of day trips for seniors to get out and to be active. There's the Walk indoor mall walking program, and there is a Living Well program, which speakers come in to talk to seniors about different healthier lifestyles, and there's interactive displays and demonstrations, and it just offers them a place to be active with other people. Some other community supports are different companies within Barrie, such as MediChair. It's a store here in Barrie on Bell Farm, and it, along with Shoppers Home Health, which is part of the Shoppers Drug Mart store. These stores offer equipment such as walkers and canes, bath chairs, wheelchairs, scooters, home elevators, ramps for both home and vehicles, and lift chairs such as the Lazy Boy type chair. And this chair is operated and controlled electronically, and it lifts the chair to make it easier for people to stand. Another agency that supplies similar equipment is the Canadian Home Medical Equipment, and it supplies very similar things as MediChair and Shoppers Home Health, but the one thing that they have is a stair lift that is, when installed, it's installed along the wall side of the stairs, so the senior sits in the chair and it carries them up the stairs, so they're able to stay in their home longer and continue to be independent. This system is an electronic system, and it has a battery backup. Some other community resources are the North Simcoe, Muskoka Integrated Regional Fall Programs, and this is offered through Soldiers Memorial Hospital in Orillia, and it just helps seniors be more aware of their surroundings and helps them maybe assist. Other community resources are the North Simcoe Muskoka Integrated Regional Falls Program, and that's offered through the Soldiers Memorial Hospital in Orillia. And this program is to inform seniors as to risks that they could have at home, potential fall risks, or if they've had a fall, that they can be aware and be able to be in their own home as long as possible. The Barrie Community Care Centre offers workshop series on several topics for clients to aid in their activities, and it's for seniors or anybody actually in the community to take part in. VON offers a program called Smart Seniors. It's an exercise program. It is a 12-week health and wellness program for people 55 years and older and frail living on their own within the community of Simcoe, Muskoka.